Good morning, sir. Today I'll be doing the return demonstration of bed bathing, feeding, and shampooing. First is make sure that the patient is in her stable position to provide the quality of patient's care. Make sure to knock the door before you enter the patient's room. Open the door politely and ask permission to the patient when you are doing the procedures. And if the client or the patient agrees, then start the procedure. Close the curtains to provide patient's privacy. Continue the procedures and make sure that the bed rails is lowered down. Remove the patient's pillow slowly and assist the patient's head. Move the patient sideways or near to the caregiver to make the procedure done properly. Of course, we need to assist the patient for them to feel relaxed and comfortable. Next is lower the other side of the bed rails. Ask the patient to move sideways before doing the procedure because we are going to remove the liquids from the patient or the outtake of the patient before doing the bed bathing. Make sure that the patient is comfortable and always ask permission before doing any procedures. After removing the patient's fluids, remove the bedpan and start the bed bathing procedure. And of course, I ask the patient before doing this procedure and the patient agrees. So first, put towel below the calipad and then put the calipad and then put the head of the patient above the calipad and then begin the procedure. First, rinse the patient's head or hair. Do it slowly according to the patient's comfortableness. Remove the calipad and wrap the patient's hair or head with clean towel. And then begin the procedure of bed bathing. When doing the bed bathing, we need clean towels and begin the procedure to the face, from forehead to the cheeks. Rinse it with water first and then proceed to soaping. Apply to the patient's face slowly and gently. The next is rinse the patient's face. Continue the procedure, rinsing, soaping, and then rinsing. So next, the hand from lower to upper. Rinse it first and the next is soaping or soap it. Rinse it with clean water. Help the patient to rinse his or her hand. Move to the other side of the patient's hand, and then the same procedure from lower to upper. Rinsing, soaping, and then rinsing again. Once the procedure is done, cover the patient's hand with the top sheet. Next is the legs of the patient, the foot of the patient. Same procedure, rinsing, soaping, and then rinsing. Make sure that when cleaning the patient's private part or the leg part, the foot part, make sure that the patient's top sheet is always lowered down to provide patients privacy. Move to the other side of the patient, the left legs of the patient. Same procedure, rinse, soap, and then rinse. Make sure that the patient's privacy is maintained. Cover the patient's private part or the leg part with the top sheet. From lower to upper, next is help the patient to rinse his or her foot from right side to the left side as well. Then after that, move the patient to a recovery position. When cleaning the back side of the patient, of course, we need to help the patient while moving. Then same procedure, rinsing with white clean towel and also clean water from upper to lower. Next is soaping. And the next is rinsing again. Next is the patient's private part. If your patient allows you to clean his or her private part, then do it. And if the patient is uncomfortable, so let them do the procedure. But also you need to guide them. So in my case, the patient is So in my case, my patient is not comfortable when the caregiver is cleaning his or her private part. So I let my patient to clean her private part. Start with the breast. And the next, remove the patient's old dress and exchange it with a clean new clothes or hospital gown. And the next, remove the patient's top sheet or the old top sheet and then put a new clean top sheet. Make sure that the patient is comfortable before eating and toothbrushing. Help the patient to eat. Next is help the patient to brush her teeth. So after all of that, put the patient's pillow on her head so that the patient can rest. Aftercare and then document the procedure.